How is everybody doing this afternoon? Weird little Tuesday in the air and the light today. A dreary little day down in little Las Cruces, New Mexico. Perhaps you don't agree. Anyways, it's like we are on, everybody. Good evening, wonderful viewers. I'm Dr. Joaquin Acosta, the heart and soul behind Know Your Pharmacist live stream and the driving force behind Farm True. Tonight, we embark on a journey not just through the realms of healthcare and innovation, but through the very fabric of human connection and technological advancement. As we delve into the groundbreaking Medicare drug price negotiations, we're not just talking about policy, we're talking about a seismic shift in healthcare, a stride towards affordability and access for millions. It's a dance of strategy and empathy where each step impacts lives. In our Tech Talk, prepare to be amazed by NASA's latest marvel, the first FDA-cleared wireless arthroscopic camera. This isn't just technology, it's a leap into the future, blending space innovation with medical precision. We're going to be looking a little bit about, the NASA spinoff 2024, an annual publication that these guys have. And, I think it's pretty cool stuff to look at here. Anyways, and in our Enlightenment Hour, we're going to explore the subtle yet powerful world of language style matching in relationships. It's not just about words, it's about understanding, connecting, and evolving together. Pretty cool. As we dissect the legislative changes in Santa Fe affecting the cannabis industry, we're not just discussing policy, we're navigating the intricate pathways of progress and challenge. Our community spotlight shines on the inspiring initiative by the Boys and Girls Club of Las Cruces. Transformation, innovation, and community, it's all there in their remarkable journey. And finally, in our Men's Health Minute, we tackle a topic often shied away from: toenail fungal infections. Guys, knowledge is power, and power is health. Let's break the stigma and embrace awareness. Together, guys, we're not just sharing information, we're crafting a tapestry of knowledge, compassion, and empowerment. So join me in this enlightening odyssey and let's reshape our world for the better. Welcome to the Know Your Pharmacist live stream. Let's begin. Medicare, reshaping the drug pricing dynamics, legislative day in New Mexico happening. Guys, if you're up there in Albuquerque and you've been up there, for whatever various industry you're in, we'll talk a little bit about cannabis today. But, talking on the national stage, in our Pharmacist Frontline segment, we're talking about Medicare kicking off the first drug price negotiations. It could get heated. So, let's unpack this a little bit, see why it's important, not only to us, but to our Medicare patients, right? For sure. So the government is beginning to start negotiating prices on the 10 costliest prescription drugs covered by Medicare this week, setting the stage for a fierce tug of war between U.S. officials and drug makers as the Biden administration attempts to lower soaring drug prescription costs for older adults. Granted, this problem has been a problem for multiple amounts of presidential terms there. So this is not quite a Democrat or Republican thing. This is a capitalism gone crazy kind of thing over a long period of time in America. So anyways, Medicare provides health insurance coverage to more than 65 million people in the United States, according to the Centers for Medicare and Medicaid Services, or CMS. The negotiations, as mandated by the Inflation Reduction Act, are slated to run through August 1st before final prices are announced on September 1st. Uncharted territory for Medicare, which has never before been able to directly haggle with drug makers over prices. Guys, that's important. According to Lawrence Gostin, director of the O'Neill Institute of the National and Global Health Law at Georgetown University, I expect negotiations to be intense. Big Pharma is likely to dig in its heels and use a variety of strategies, including fierce negotiations. So Thursday, the CMS expected to send first pricing offer to each drug company that makes the 10 selected drugs. And the drugs under negotiation, guys: Eliquis, a blood thinner from Bristol Myers Squibb and Pfizer; Xarelto, a blood thinner from Johnson & Johnson; very common brand name, direct oral anticoagulants that are incredibly expensive, right? Januvia, diabetes drug from Merck, right? Oral. Jardiance, a diabetes drug from Boehringer Ingelheim and Eli Lilly. Enbrel, a rheumatoid arthritis drug from Amgen. That's what we're talking money, right? Imbruvica, a drug for blood cancers from AbbVie and J&J. Farxiga, a drug for diabetes, heart failure, and chronic kidney disease from AstraZeneca. Entresto, a heart failure drug from Novartis. Stelara, a drug for psoriasis and Crohn's disease from J&J, and then Fiasp and Novolog, diabetes drugs from Novo Nordisk. So guys, I'm sure if you are in the medical world or if you're a patient, you know exactly which drugs these are because you either had to fight with your insurances or pay big on copays for a while to get down your deductibles, right? When we're talking Medicare and things like that, guys, I mean, brand name medications can be an absolute bear, especially depending on the kind of price, especially depending on the kind of Medicare plan that you choose can really, really affect the price. And again, those of you who are on Medicare and you're taking these expensive brand name medications, it's very important to make sure your plans have coverage for them. And these are things that more than likely you've already probably worked on because you're going to see at the end of the day those numbers chipping away at your wallet, right? But some people get on the wrong side of that, without even knowing. And that's where we're hoping that maybe we see a little bit of actual price negotiation happening here, guys. And prices charged by pharmacists to patients or insurances before discounts or rebates, according to an analysis in January published by the Commonwealth Fund, a research group focused on healthcare. Those 10 drugs that I just named were 3 to 8 times higher compared to other countries of similar size and wealth. So, balloon pricing, guys, is a thing. United States, globally, we pay more for just about every single brand name medication ever. And even generics, maybe the generics might slip through and be, neglectable in terms of the cost differences. But some of these brands, guys, I mean, the interesting part there noted is, yes, 7 other very similar economies and countries there that are paying significantly lower drug costs, overall. And so that's where the negotiations, direct manufacturer, direct with the insurance, whole thing need to be really rearranged because the United States has been swindled in more ways than one, right? The biggest swindle, I think, in pharma and medicine is the opioid epidemic, guys. That was a 20 to 30 year hustle, self-induced by our own destruction. So anyways, let's move on from the Pharmacist Frontline segment. We'll hope that we can keep a monitored eye on this, but either way, this is another reminder for those of you who are considering what Medicare plans might be in your wheelhouse for the future. If you're about to be turning, the age of 65, or you're already on Medicare, or you're a caregiver for somebody with Medicare, looking at those line items, working with a Medicare broker, or particularly a local one who can help you, identify your needs when it comes to coverage. I mean, really could mean all the difference on your bottom line at the end of the year, for sure, for your medical costs, everything like that. So, that's the take-home point. Guys, let's move on. Tech Talk. This is an interesting one. Let's do a little breakthrough from NASA here. So, pretty cool stuff coming out of the NASA spinoff for 2024. NASA's showing off some of the innovations that it has. But I like this because, we do see a lot of different health tech startup companies and things like that, but it's cool to see what, NASA's got going on. So check this out. Cutting the knee surgery cord. NASA experts offered early advice on the first FDA-cleared wireless arthroscopic camera. look at that thing, right? Anyways, years ago, Eugene Malinsky saw a physician assistant trip over the cords of an arthroscopic camera during a medical procedure. He recalls the story when people ask why he and his brother co-founded the medical device company that claimed to be with this deal. But again, the assistant fell to the floor, pulled the cables off the patient, and needed to be wheeled out of the operating room. Procedure had to be postponed. And so that was the outcome of that. And anyways, to get rid of the cords, the Malinsky brothers needed a power source and a wireless communication technology. They drew up the design plans to fit those innovations into an economical and ergonomic package, something that would be comfortable and not too heavy to hold for long periods. So, looking at where that whole thing works in the wireless, camera system, guys, it really does, change perhaps even the extra precautions and maybe other errors that happen in the operating room, in medical, with medical devices and surgeries, things like that. I mean, being able to just look at things like tripping hazards or just the ergonomics of, all of the devices that we use in the medical world. I mean, this is pretty cool. I like it. I think, you see a safe, usable, applicable technology. The first wireless camera system for minimally invasive surgeries, guys. Pretty cool stuff. So I want to share out some NASA health tech innovations. Guys, let's move on. Got a little study for you on our Enlightenment Hour. Ever heard of language style matching? I hadn't really either, but guys, let's take a look at this. So language style matching predicts relationship initiation and stability. Talking about what the heck that means, right? So look at this. Previous relationship research has largely ignored the importance of similarity in how people talk with one another. Using natural language samples, they investigated whether similarity in dyads' use of function words called language style matching predicts romantic relationship outcome. In study 1, the transcripts of 40 speed dates predicted increased likelihood of mutual romantic interest overall. 33.3% of pairs with LSM above the median mutually desired future contact, compared with 9.1% of pairs with LSM at or below medium. Interestingly enough, study 2, 86 couples, instant messages positively predicted relationship stability at a 3-month follow-up. So you can literally look at, conversations and language style matching and compatibility and stability between, what are indicators there that things work, and you kind of look at the why and the where. And this isn't only applicable for, romantic relationships. This is also, quite applicable for interpersonal relationships, whether it's workplace, family, friends, community, however you want to call it. But, if we look at culture as well, and you think about things like language style matching and how perhaps the weight that it carries in our culture, right? Language style matching predicts relationship initiation and stability. Interpersonal similarity plays an important role in the development of romantic relationships. Similarity in terms of values, interests, and personality traits are known to predict mate selection and, to a lesser degree, the long-term success of romantic relationships. Other works suggest that people who exhibit similar nonverbal cues when talking with each other are more likely to be attracted to each other. More broadly, when two people meet and automatically coordinate hand gestures, eye gaze, and posture, they are more likely to like and understand each other. And right, we get these things, but then you sometimes think of the nonverbal ways that, maybe first impressions or first relationships you may have ever had with somebody are more natural, things like that. And you look at how those relationships evolve over time, you'll probably notice that time is going to sift you towards, more people that you're going to be language style matching with. That's an interesting, behavioral and societal kind of concept here. When you do think about how that may, imply a different situation, person by situation, pretty much scenarios, right? So often overlooked in the behavioral and social sciences are the fact that couples actually talk with one another about their conversations, often serve as the basis of their attraction. Remarkably, little work has been done on synchrony and natural language use between two people who may become or are currently romantically involved. One recently developed tool that sheds new light on the synchrony in real-life relationships is an unobtrusive measure of non-conscious verbal coordination called language style matching. Right? So where you're looking at that, it's the measure of the degree to which two people in a conversation subtly match each other's speaking or writing style. Although it naturally occurs in most everyday conversations, LSM or language style matching is undetectable by both speakers and trained observers. Furthermore, like eye gaze coordination, language style mapping is thought to map directly to the interpersonal coordination of psychological states. The purpose of this paper is to investigate whether naturally occurring LSM between potential and current romantic partners produce romantic interest and long-term relationships. So you look at that, right? The focus of LSM is a person's speaking or writing style, which is defined by his or her use of function words. Looking at those things, function words such as pronouns or articles are generally short, frequently used, and have little meaning outside of the context of the sentence. As a result of these function words are processed rapidly, largely non-consciously when people produce and comprehend language. So, where you're doing that and require shared social knowledge, common ground to use effectively, function words, for example, in the sentence, he placed it on the table, makes little sense without prior knowledge of the man, object, and table in question. Perhaps because of their key role in social cognition, function words are robust markers of a variety of individual differences ranging from leadership style to honesty. As such, language style matching theoretically reflects interpersonal alignment across the array of psychological states that function words represent. So focusing on function words rather than content words such as nouns and verbs, language style matching allows researchers to assess the psychological matching irrespective of context. Whereas function words are independent of conversational topics, content words are often constrained by them. For example, while two friends who work in an office building in a rock quarry respectively would likely use very different content words during conversation about their days at work, research suggests that their function words would be similar to the extent that the friends like and understand each other. So, interesting, right? Among function words, personal pronouns appear to be particularly relevant to relationships. Married couples who use we more often and you less often have lower divorce rates and report greater marital satisfaction. In dating couples, on the other hand, women's use of first-person singular pronouns I, my during instant message conversations positively predicts relationship stability. Weird, right? However, in these previous studies, each individual language was the use of focus analysis, right? So in contrast, naturally occurring verbal matching requires some degree of complicity on both sides of the conversation, much like eye gaze and postural sway coordination. So by analyzing function word matching at these levels, LSM hypothetically reflects not only each partner's attempts to engage each other, but also the degree in which the attempts are reciprocated. So, you start looking at all those little kind of microcosms of a romantic relationship, of an interpersonal relationship, whatever it may be. I mean, it's a very interesting study, right? And, you can almost look at some of the nature of that. And when you start obviously unpacking some of that, it does come down to very individual things there that have to just be identified. You reciprocate, for instance, one thing in a conversation with somebody, then they're not, reciprocating back. I think in a simple term, most people, are pretty adept to eventually, figuring that out. But a lot of the time people could be, perhaps in a false reality, right? With some of that notion. But, anyways, guys, looking at the general discussion and some of the stuff, I mean, it's just interesting pretty much to consider here, maybe when you consider just the way conversations go, relationship, like team building, leadership, when you're a healthcare provider talking to patients, however, that context goes, style matching and relationship engagement each reciprocally increase the other and jointly facilitate positive relationship outcomes. So, language alignment causes mutual understanding, things like that. But guys, using the word we, really understanding if somebody is, having a high LSM conversation or a low LSM conversation. Take a look at this example. So, for example, here you're looking at pairs who match a higher LSM pair, where we're going to see pronouns, personal pronouns, be more than one on the other, auxiliary verbs, one on the other, negations, has less, right? So very interesting when you look at the data here. Anyways, higher LSM match here. Let's get the basics over with. What are you studying? I'm studying econ and poli-sci. How about you? I'm journalism and English literature. Okay, cool. Yeah. All right. Where are you from? I'm from Iowa, a town of 700. I'm from New Jersey. Probably not 700. Well, I mean, actually, believe it or not, where I'm from in New Jersey has a lot in common with like Iowa and stuff. How are you enjoying Northwestern? Guys, this is like, some DM conversation or however to do it these days, right? Considered, and it's just kind of funny where you can literally look at these kind of conversations and see, hey, is this couple going to be compatible? That's very interesting, right? So that ends with, I like it a lot. Obviously, it's a big transition coming from small town Iowa, but I love the city and have a really good time. So, looking at that pair, they match each other's use of personal pronouns, auxiliary verbs, and negations, whether consciously or subconsciously, they did it on, that pretty much effectiveness of a scale. And so the other one had a bigger range here, right? Because these percents were very close. But these percents, we were looking at 15% in the use of personal pronouns from one person and less use from the other, more use of auxiliary verbs from one, less from the other, right? So it's interesting. Where are you from? Connecticut. How about you? I'm from Austin, Texas. Texas, nice. Okay. When you say football, I understand football. Oh, okay. That's kind of like one of those things. That's you a UT fan or a fan would be the wrong word, an understatement, or no, the wrong word. Okay, I've had enough football last my lifetime. Oh, okay, well, so what are you studying there? Oh, I study opera and mechanical engineering. That's interesting. Are you in the music school? I am. So, anyways, you dissect that whole entire conversation, which just seems like a casual conversation. Literally, the differences between the matching of, the personal pronouns, right? Me, I, we, right? The auxiliary words, the negations, literally almost have to be on point for you to see that much of synchronicity between, two people. And this is examples in a romantic relationship versus anything else. But, the implications there, very interesting. Obviously, you can get people to work together and things like that. You can, know certain things, but I mean, if you had a better idea of, certain other psychological traits or personality, things that are happening at a point in time because of the use of, certain words, and where we're talking about, personal pronouns, negations, auxiliary verbs. I mean, these are not the traditional, words that you're thinking here, right? Personal pronouns, I, his, there. And personal pronouns, it, that, there. Articles, a, and, conjunction, and, but, because. Prepositions, in, under, about, right? Auxiliary words, shall, be, was. Negations, no, not, no. So you know, just interesting overall. So always good to know you, but always good to maybe know, like, you know, maybe where that intuition may even come from when you're having a natural conversation. You're like, this, how does one partner end up not matching with the other partner? Well, maybe a weird pattern in language that we never even realized that was happening since the beginning. Crazy. Guys, let's move on. Herbal Wellness Corner, guys, brought to you by High Horse Cannabis Company. Go shop High Horse. All of your cannabis needs, guys. One thing going to show today, as we're talking about legislative day, just referred to that a little bit. Anyways, up in Santa Fe, they're talking cannabis right now. One of the big frustrating things right now is like a 3-year tax hike on cannabis. It's going to be increasing, the taxes that, are already eating up the cannabis industry in response to try to maybe flush some black market cannabis out or something like that, but it doesn't really make any sense. Anyways, regardless of the, fact that cannabis seems to be kind of getting a little disrespected by our legislative office there when I'm showing you guys here proposing prohibiting drive-up windows at cannabis establishments here in New Mexico, here in the Senate Bill 6. Pretty ridiculous. Don't like it. Plenty of people have reasons to lobby for plenty of things right now, guys. Taxes suck. Not much we can do about that right now in terms of wiping the tax increases, but something that you can do is try to call your reps right now and get this prohibiting drive-up windows at cannabis establishment amendment completely thrown away, because that's silly. So we're not even gonna consider that like a reasonable offer there from the legislation, guys. People need their medicine. What the heck? I don't know what drive-up windows. If that was the case, right, are you going to close up drive-up windows in every pharmacy in the state? Where does the line draw? So, super weird. I don't understand how that situation, creates this amendment to SB 6. But, it's ridiculous, guys. For those of you guys who have pretty naive to the New Mexico legislature website, such as myself, nmlegis.gov. You find your legislators, guys, and give them a call, let them know, if you really want to participate and get all the way in there. Advocates, you know what you got to do. Make your calls, tell your friends. Other than that, that's going to sum it up. Shop High Horse, baby. Go through that drive-thru and enjoy it. These drive-thrus ain't going nowhere. My ass. No way. So, all right. On to some better news. Just kidding, that wasn't bad news. Guys, the Las Cruces Boys and Girls Club in our community spotlight, taking over the Shuttered movie theater, $1.4 million revamp. Pretty cool. So the Boys and Girls Club of Las Cruces using funds from the American Rescue Plan Act to take over a former movie theater shuttered during the pandemic. The organization recently announced the club received $1.4 million in the APRA funds to move the facility 330 West Las Cruces Ave since 1965. Now, however, it's going to move into the former Allen Video 4 Theater at 1005 El Paseo Road, closing for good in 2020 during the pandemic. I swear in the last year that place was on fire. So, yeah, that's all I gotta say. It's cool that either way, whatever damages happened in that building, somehow we are going to make some good use out of that building. I'm glad it's now going to get revamped. El Paseo Road, And the projects here in our city and Elevate Las Cruces, that whole thing is a big plan there. So I think that's a cool use for El Paseo Road, which is becoming quite a cannabis road here in Las Cruces. So, anyways, cool stuff to see that Boys and Girls Club of Las Cruces can get a nice big place. I hope that this is going to be ends up being a super cool community spot for local Boys and Girls Club for sure. All right, guys, let's get on the last thing, Men's Health Minute. Toenail fungus, guys. This applies to women too, but in our Men's Health Minute today, wanted to go through a little bit of topics with you guys here. Coming at you from Harvard Health, dealing with thick, discolored toenails. Sometimes in the pharmacy, sometimes a patient, we know we got those toenail fungus, OTC stuff, but what the heck is it all about, right? And looking at it, wriggling toes in the sand, wearing sandals or warm weather trees, unless you'd rather keep your toes under wraps. Due to thickened, yellowish nails, nail fungal infections known as onychomycosis are common, affecting up to 14% of the general population. In advanced cases, nails can become brittle, crumbly, or ragged, or even separate from the nail bed. While completely curing these fungal infections is difficult, the right treatments can discourage the problem from spreading and make your nails look better. So, guys, how do people get it? Sweaty feet, fungi feet, guys, locker rooms, spa gyms, even a pedicure at a nail salon, could give you toenail fungus. And so, antifungal creams get the skin, but the toenails are different, right? So you're talking about how to actually penetrate the nail tissue. So the medications that are traditionally in that cream form do not have, that oily, penetrable substance. So when we're talking about what can we do over the counter? Tea tree oil, 100% tea tree oil, guys. We like those. You do have toenail fungus options, your other OTC stuff, and I'm going to show you right here. I got a question on IG from Nicholas about what do you think of using GLP-1 receptor agonists for potential fatty liver reversal? I think there's some trials in the pipeline, but no new indication approved yet. I think I might have briefly saw something about that. I've seen the effects of the fact that it makes GLP-1 receptor agonists seem to make people just truly cut alcohol, and just from that appetite suppression and the fact that you're cutting your alcohol, your liver's already regenerating. We know our liver is a very, very, very durable organ, right? And it can regenerate. And so just by considering the fact that most people on GLP-1s can't even keep up that original uptake of alcohol that they have, it'll just, kind of don't even want to. And I've seen it. So, but I've never seen it obviously prescribed for alcoholism, just prescribing for losing weight, but, for whatever reason that happens. And so, in terms of using it for potential fatty liver reversal, I could perhaps see that maybe being a thing. So I don't see why not. I know we're worried about the pancreas when we're thinking of GLP-1 receptor agonists, but I don't consider this that. So anyways, thanks for the question, Nicholas. Anyways, and that's about all I got for you guys. Toenail fungus. Unless you have something that you use, people have different products that they like or they recommend. Again, cheapest thing that you can get, tea tree oil. You can get all your nail fungus stuff, Lamisil, Lotrimin, Carousel, Lonely Nail, Dr. Scholl's, try tea tree first. I'm telling you, you'll save probably at least $5 to $10 for sure. Anyways, thanks, Nicholas. Hope you guys have a good evening. Guys, we're signing off for today.